Okay, today we will be seeing about biocompatibility of dental materials. Coming to the introduction, biocompatibility is the ability of a material to elicit an appropriate biological response in a given application in the body. It is capability of the material to exist in harmony with the surrounding biologic environment. Requirements of a biocompatible material. It should not be harmful to pulp and soft tissues. It should not contain toxic diffusible substances. It should not have any carcinogenic, that is, cancer creating potential, and it should not cause allergy. Coming to the evaluation of biocompatibility, biocompatibility tests are classified on three levels or three tiers. Group 1 is primary tests, Group 2 is secondary tests, and Group 3 is usage tests. Coming to the primary tests, these primary tests are usually in vitro in nature. They are carried outside, that is in test tubes or in cell culture dishes or in flasks. It is placed in contact directly or by means of a barrier. These are done to evaluate in vitro cytotoxicity, mutagenicity, and systemic toxicity. In vitro tests may be direct tests or indirect tests. Coming to the cytotoxicity tests, these are placed directly on the tissues, culture cells, or membranes overlaying them. And genotoxicity tests. It determines carcinogenic or mutagenic potential. It is used on mammalian or non-mammalian cells, and it evaluates gene mutations and chromosomal structures. Coming to the primary tests, it can be direct cell culture tests or membrane integrity assay or barrier screening test or agar diffusion test or filter diffusion testing method or dentin barrier testing or tooth slice culture assay or Amy's test or Stiles test. Coming to direct cell culture, mouse fibroblasts or human epithelial cells are used. The culture dishes are placed until a monolayer of cells are formed, and the tested material is added to the culture and placed for 3 days. Coming to agar overlay method, here we see the control and the sample and the control, and in the down we see the stained cell layer. Coming to the dentin barrier testing, uh, coming to Amy's test, Amy's test is a genotoxicity test. Here, the experimental tube is seen, and liver extract and suspected mutagen is placed in the test tube, and the culture of Salmonella species is done. And in another test tube, the control tube, liver extract alone is placed, and these two test tubes are placed in separate medium lacking histidine, and it is incubated. And in case of things which are in which Salmonella species is present, colony of reverent Salmonella is seen. And in case of the test tube where we have the liver extract alone, there is no Salmonella growth colonies. Coming to the secondary test, it is mostly conducted on animals like mice, rats, hamsters, or guinea pigs. It tests the inhalational toxicity, skin irritation, sensitization, maximization test. It also includes implantation responses and Bueller's test. Coming to the animal test, the advantage of using animal test is that biological responses are more comprehensive and it is more relevant than in vitro tests. Coming to the disadvantages of animal tests are it is difficult to interpret and control, it is expensive, it is time consuming, and also ethical concerns. Coming to mucous membrane irritation tests, uh, we also do skin sensitization tests where we use dermatol in the skin of the animals, and also implantation tests are used. In case of implantation tests, the polyethylene tubes are used and the test material is placed inside it. In case of short-term implantation, it is placed for 1 to 11 weeks, and in case of long-term implantation, 1 to 2 years, the material is placed inside the animal body. Coming to the usage test, it is performed on animals or humans. It is used to test both pulpal and bone response. On humans, it is called as clinical trial. Various tests are pulp dentin test for restorative material, pulp capping and pulpotomy material test, mucosal damage and mucosa usage test, gingival usage test. And in case of pulp capping and pulpotomy usage test, the pulp is merely exposed and partially removed for pulpotomy assessment. and also application of a particular cement is done using this, and also dentin bridge formation is also observed using this test. Coming to the standards that regulate the measurement of biocompatibility, the first efforts of American Dental Association to establish guidelines for dental materials came into existence in 1926. The ADA specification number is 41. Three categories are described in 1982. It is initial, secondary, and usage tests. So international efforts were initiated by organization to develop international biomedical materials and devices. Coming to the standardized organization, ISO, which is published, which has published the final document in 1992. It contains 12 parts. The ADA specification from Council on Scientific Affairs, American Dental Association, has resulted in sending to FDA for its approval. The product is approved by FDA if it passes the primary and secondary test, and it is used for dental material manufacturers for a period of 7 years uh, to prove the efficacy. US FDA classified the materials into three groups based on the relative risk factors: Class 1, Class 2, and Class 3. The Class 1 includes low risk materials, and Class 2 includes the materials required to meet FDA performance standards, and Class 3 includes most stringent category which needs approval for safety and effectiveness before marketing. Coming to the physical factors affecting pulp health, it is micro leakage. Here, the penetration of the fluids along interface between the restoration and tooth is seen. It can result in secondary or recurrent caries in case of pulpitis, pulpal abscess, etc. In case of staining or discoloration, and sensitivity due to continuing pulpal irritation. Coming to the nano leakage versus micro leakage, nano leakage and micro leakage, in between we see the ideal leakage. And coming to the thermal changes, thermal temperature fluctuations may crack the restorative material, leading to micro leakage, which can result in the restoration failure. So metals are good conductors of heat, causing sensitivity with large metallic restoration. Example in case of amalgam and gold inlays. Coming to galvanism, flow of current when two dissimilar metallic restoration come into contact, where it is due to different electromotive potentials, and saliva acts as electrolyte. When it contacts with the when dissimilar metals contact each other, it results in short circuit current flowing through the pulp, and which causes pain and discomfort. Coming to estrogenicity, chemical may act as similar to estrogen. Bisphenol A on acts as an estrogenic receptor in cells. So E-screen has a growth response of breast cancer cells that are estrogen sensitive is observed. Coming to the biocompatibility of dental materials in the oral environment, in latex from the rubber tree, ammonia is added as a preservative, vulcanization uh, allergy, and it angioneurotic allergic reactions such as edema, chest pain, and rash on the neck and chest of severely allergic patients are seen. Skin irritation tests using epinephrine is done. Coming to the casting alloys is a mixture of two or more metals. The element is released from an alloy to cause allergy. Coming to beryllium, in nickel chromium alloys, it, to increase the castability of these alloys, and for the chemical bonding of porcelains, for documented carcinogen in metallic or ionic state, and in case of berylliosis, where inhalation tests are performed. And in case of nickel, it is the most allergic element along with palladium, and metals in alloys and their effect in tissue are seen. Beryllium is carcinogenic, cadmium is carcinogenic, chromium is carcinogenic, cobalt is carcinogenic, copper is mutagenic, gallium is not mutagenic according to in vitro studies. Nickel is carcinogenic, palladium is mutagenic with low risk, and tin is mutagenic, zinc is non-mutagenic, and iron is mutagenic. Coming to amalgam, it is determined largely by corrosion products released, and it is the unreacted mercury from amalgam is toxic, and copper is also toxic into the gingival previs. It may cause inflammation of the gingiva. Coming to amalgam and mercury, mercury itself has no effect on pulp. Acute mercury poisoning and chronic mercury poison is seen. In case of chronic mercury poisoning, weakness, anorexia, weight loss, insomnia, irritability, dizziness, and tremors are seen. Coming to methyl mercury poisoning, paresthesia, ataxia, and tunnel vision is seen. In case of miracle mix of amalgam, the cavities with the depth of about 2 mm were between the cementoenamel junction and the root tip. We can observe it. The teeth are reimplanted for after restoration. The animals were sacrificed at 6 months, and results suggest that resin composites can release cytotoxic materials. Coming to the cements, zinc phosphate, in vitro screening tests are which show strong to moderate reactions. Coming to the usage test in deep cavity preparation, moderate to severe, and it shows localized pulpal damage in 3 days. Coming to the toxic reaction, were observed in a permanent growing cell line. The pH of the said cement is 2. Coming to zinc polyacrylate, in short tissue culture test, the release of zinc and fluoride ions in reduced pH is seen. After 3 days, the pulpal response of polyacrylate cement is same as zinc oxide eugenol. Coming to zinc oxide eugenol cements, in vitro test depresses cell respiration and reduces nerve transmission with direct contact. In usage test, slight to moderate inflammation within the first week is seen. It shows reduced to mild chronic inflammatory changes and reparative dentate formation within 5 to 8 weeks. Coming to resin modified glass ionomer cements, uh, hectaethyl methacrylate diffuses through the dent into the pulp. Persistent inflammation and allergic reaction can be seen. It can penetrate latex and cause contact dermatitis. Resin modified is better than conventional GAC biocompatibility. Coming to impression materials, irreversible hydrocolloids that cause inhaling fine airborne particles, that is dust, can cause silicosis and pulmonary hypersensitivity. Dustless or dust-free arginate is preferred. Coming to elastomas, cellular toxicity levels, polyether is better than addition silicon, which is better than polysulfate. Polysulfate. Coming to the impression materials, Canarek described a clinical case of polysulfide impression material. Severe inflammatory reactions are seen. And another study on toxicity of impression materials using human fibroblasts were done. And polyether materials are more cytotoxic among polyvinyl siloxane. Only the light body induces clear inhibition of cellular viability tests. Coming to polysulfide rubber impression material, ADA measured toxicity by injecting material into the oral mucosa of baboons for 48 hours. Light bodied materials were less cytotoxic and contain less lead. Lead peroxide are used in materials for radiographic diagnosis. Coming to ceramics, the ceramics systemic toxicity is extremely low. Silicosis, that is fibrotic pneumococcidiosis, is seen, and inflammation after implantation in the muscle is seen. Uranium oxide causes radioactivity. Coming to the denture-based material, heat polymerizing, light curing, or chemically curing. In case of methyl esters of methacrylic acid are basic modules of polymethyl methacrylate. It is cytotoxic to epithelial cells in culture. Initiator, which is used as dibenzoyl peroxide, and the cross-linking agent is ethylene dimethacrylate, which are most common allergens. Water at 37 degrees Celsius before insertion to remove the major share of the leachable substances done. Coming to the denture adhesives and soft tissue liners, cell culture tests are done, which is extremely cytotoxic. In animal tests, it caused significant epithelial changes. In usage, mild cytotoxicity was found. Coming to the silicon maxillofacial elastomer, silicons are most widely used. The study on baboons implantation, subperiosteal, submucosal, and intramuscular maxillofacial elastomas were done. In the study indicated that inflammatory response and not capsule thickness is used as indicator. Coming to the summary, the biocompatibility of dental material depends on its composition, location, and interaction with the oral cavity. Coming to the materials, that appear biocompatible when in contact with the oral mucosal surface may cause adverse reaction if they are implanted beneath it. In case of interaction between the material and the body, influences the biocompatibility of the material. These are